Let's begin to address the question, do I really need surgery? Now, again, the most important point to remember when considering any weight loss surgery is, are you able to lose weight through any other means, through a significant change in your nutrition, by adding exercise if it's physically possible? And is there any place in the limited role for medications for weight loss? But if we explore those three areas, and you feel like you have made your single best effort, and you're honest with yourself and really truly believe that you've given this everything you can, then it's time to talk about surgery. But it's only when these three mechanisms have failed that we should really start thinking about surgical options. Surgery does not replace the need to change your diet. And those people who go into surgery with that expectation end up being very let down by the surgery, and often will regain a significant amount of weight. So I think that's such a critical point to make, that this is surgery plus nutrition, plus exercise, and even occasionally plus medications in order to solve this problem. Obesity is a very difficult health problem to solve. And it's only through a concerted and multidisciplinary effort that we can typically get the results that most people hope for and expect from these procedures. Another thing to remember when making this decision is that surgery is a medical treatment, like any other medical treatment. And just as medications have variable effects, where one medication may work great for one person and not work at all for another person, we see the same thing with surgery. And even within these surgeries, gastric bypasses and sleeve gastrectomies have different ranges of therapeutic effect, where a gastric bypass tends to have a fairly narrow range, meaning most patients lose a significant amount of weight. Although there's some variability, it runs in a narrow category. Then we see with the sleeve gastrectomy, where we have some patients losing amazing amounts of weight, and other patients really not finding a tremendous amount of success with these surgeries. But there's variable results, and then these surgeries also have a variable duration of effect. People think, well, if the stomach's small, I'll never be able to eat big portions again, and I'll never have to struggle with obesity, but that's simply not true. Over time, you can eat very reasonable sized portions, and what we find is that the control of your hunger and the control of your body weight and the control of your metabolism oftentimes starts to wear off over time. And there is a lifetime of these surgeries. While some patients are able to maintain their weight for the rest of their life, there are certainly others who after 5 or 10 years will start to gain weight. Oftentimes what we're seeing is that there's other health factors at play, like inactivity or injury. If you're starting to lose your mobility, where you were able to maintain your weight after surgery before you became injured, or before you started to lose your mobility. As you lose your mobility, then we start to see the weight creep up again. So there are a lot of other factors, and people gain weight at various points in their life without having surgery. So it's a very complicated discussion when we talk about weight regain. But it is important to recognize that there is variable results and a variable duration with these procedures, and it's not every single person gets the same results. We also have side effects, and we'll talk about those, and understanding what can happen after these surgeries and then how to treat them appropriately is part of the deal. That's something that you have to know about going into it. And finally, making this decision, again, I can't say this enough, it really requires that you are honest with yourself and do not make false promises or set yourself up with some expectation that is very unlikely to ever come true. Decision-making factors. Now, when you're deciding about surgery, there's a lot of things that go into making this decision. So we're going to have a video for each one of these topics. But your age is certainly a factor, where whether you're young or old, that impacts how this surgery is going to affect you. Your success with diets in the past, your mobility, your use of medications. If you're on medications that cause weight gain, how does that impact your decision about surgery? Your family history, and then your baseline diet. If you have a really great diet going into it, does that mean you should or shouldn't have surgery? If you have a highly processed diet, how does that impact your decision about surgery? It's really important to assess all these factors and to recognize how they're going to influence your outcomes so that you can make the best possible decision.